Have you or someone you ever cared about ever struggled with their weight? Today, more than 1/3 of the United States is overweight, with rates continuing to increase. With these increases are rises in cardiovascular disease, type 2 diabetes, and different types of cancer. My name is Amber Harmon, and today I'll be talking to you about a controversial topic within the Department of Nutrition and Dietetics, the cause of obesity. As a nutrition science student, this is a topic that I've spent a great deal of time on over the last 4 years studying nutrition at the University of Nebraska-Lincoln. Some believe that obesity is a patient's own fault and is a result of their lifestyle habits. Others believe weight is predetermined and as a result of their genetics. The goal of this speech is for you to understand that our genetic makeup plays the greatest role in determining how we maintain our body weight. Today we will investigate cases of twins and adopted individuals. We will look at genes that increase our risk of obesity, as well as the different responses to treatments in different individuals. In regards to maintaining body weight, you may have heard the statement, calories in equal calories out. It's like a scale. If we consume the same amount of calories that we're burning, we will maintain the same weight. But this is not always true. One misconception that we have with overweight and obese individuals is that if they simply were a little bit more active or they ate a little healthier, ate a little less, they'd lose the weight. And this is not okay because this is not true. You can have two individuals who have consumed the same diet, have the same exercise regimen, and still remain on two separate spectrums. One can remain extremely thin while the other remains obese, and this simply boils down to our genetics. For a child that has two obese parents, there is an 80% chance that child will become obese. With one parent obese, there's a 40% chance that child will become obese. Even if neither parent is obese, there's still a 14% chance that child may become obese. While this is partially influenced by their environment and how active or what their diet consumes of, the genetic component is much stronger. In a study that was done by Bourgeon in 1976, they found that in an adopted child, that their BMI was much more strongly correlated with their biological parents than it was with their adopted parents. In the case that was done of identical twins that were separated at birth, they found that the identical twins had much more similar BMIs than the twin had with their adopted parent or adopted sibling. And this reinforces the idea that our genetics plays a greater role in maintaining our body weight than does the environment. There is an allele known as the FTO allele, which is a variant form of a gene which increases the risk of obesity. One copy of the allele increases the risk up to 30%, while two copies increases our risk of becoming obese up to 60%. This gene is more common in those of European and African descent, and is the least common in those of Asian descent. And these results are parallel with a study done by Gallup in 2012, which found that African Americans and European Americans were the most obese groups in the United States, while Asians were the least obese group in the United States. The presence of the FTO allele gene can also increase the effectiveness of different treatments. For bariatric surgery, those that had the FTO allele gene lost 3 less pounds than those that did not have the allele. Pharmacotherapy treatments are general treatments, and those are usually less effective. So we're currently working on patient-specific drugs that focus on each person's genetic makeup. And there's currently only one patient-specific drug out there, and that is leptin. So in conclusion, while our genetics may not be and should not be an excuse for being overweight and obese, they can be an explanation for why some individuals lose weight easier than others and why others maintain easier than others. Today we discussed how the FTO allele gene has been found to increase the risk of obesity, as well as the presence of this gene affects the responsiveness of some treatments. We looked at studies done in twins and adopted individuals and found stronger correlations with the biological families, increasing the likelihood that genetics is the component behind it. So if you're following all those nutrition and exercise guidelines for weight loss, but still not seeing the results, it's likely not your fault. So don't be so hard on yourself. You just picked the wrong parents.